So good morning, good afternoon, good evening, bonjour, bon après-midi, bonsoir, depending on where you are presently sitting on our dear and only planet. It's a real honor for me to be with you today. And the French School of Public Health, the EHESP, is very proud to be one of the initiators of this training program. The topic of these workshops reflects the long-term commitment of our institution in training current and future professionals and policymakers in community health, although I should admit that the primary field of the EHESP has been training hospital managers, but we are progressively shifting from this subject to the larger subject of community health and global health. We offer a number of training programs in the field, and we are also involved in a number of research programs on a diversity of community health related topics. I'm of course not going to cite all of them because that would be both too long and very boring, but just to mention our research projects touching on the field of urbanism for health, health promoting cities, capacity building strategies at the local level. We are increasingly involved in global health issues, and within the University of Rennes, we tackle these issues in a very interdisciplinary way, beyond the field of public health, with large corporations, with our colleagues from a diversity of fields, economics, data systems, law, and so on. With the COVID-19 pandemic, the community health field has gained increased recognition in France, which was not necessarily the case before, in part by demonstrating the limitations of our health system that has clearly underestimated the role of the workforce at the local level and faces, as most of your countries, the problem of the shortage of health workforce. The fact that you're so many connected to this workshop, it clearly I can't see all of you on the screen. I think you're more than 1,000 connected, shows the essential role played by local actions to improve population health and reduce inequalities. Before I conclude, I would really like to thank you, say thank you to all of you coming from countries of the Global South, and to tell you that we absolutely need your experience because there are clearly very numerous innovative community health practices that have been developed in your countries and that would be of very important benefit to the questions we are presently facing in our countries, at least in France. So I wish to all of you a very fruitful workshop. I hope it will inspire everyone and that everyone, I was going to say, will go home. In fact, you are at home, but we'll go back to usual business in a few days with plenty of inspiring ideas. Thank you to all of you. Have a nice workshop.